This video is on using the medical assessment check card. For this discussion, we're going to look at this in two parts. So we're going to split this card right down the middle. And we're going to look at the left-hand side first. This is the short report. The short report is the information that the operation leader, or OL, will need once you locate a subject. So it's very important that we know the location. You'll have your navigator plot the point on a map and or use the GPS and come up with a coordinate for where you are. Then we're going to want to know the patient's name. We're going to want to know their age, male, female. Those pieces of information are very critical to make sure that we're actually dealing with the subject that we're looking for, and for just general information so that when the operation leader calls in to seek extra help from EMS or whatever, that they know who they're dealing with. Pulse and respiration, you're going to take those, but for right now, all we need to know is, are they normal? So, or is the pulse high? Is the respiration rapid? We need that kind of description. We don't need to know that the pulse is 53, for example. The next thing, we don't need to worry about alert and oriented right now, and we don't need to worry about skin color, temperature. We do need to know about injuries. We want to know, in general, the person has a broken leg, or they fell and hit their head, or they're cold, or they're dehydrated. What's going on with them? We want to know what you're doing to treat them. As far as we're warming them up, we're giving them a hot beverage, and then we want to know what are we doing? What are you doing to get yourselves out of there? So, are you going to be able to walk out? Are we going to need to have additional resources? And what is it that you're asking for? Is it a Stokes basket? Is it a vehicle to meet you at a trailhead? That sort of thing. What kind of manpower do we need? Do we need to bring in all the teams? How is that going to work? The right-hand side over here, with the inclusion of alert and oriented and your SCTM, your skin color, temperature, and moisture, those belong over there as well. That's going to be the actual thorough assessment that you do. Once you've called in your short form report, you're going to continue working, your medic is going to continue working on the patient or the subject. So we always want to make sure the scene is safe before we enter. So obviously that's going to happen before you actually do any of the short report stuff. However, that is not something that the OL needs to know, unless the whole area is dangerous and you can't get in there, and they need specialized equipment. So if that's the case, then you are going to call the OL and say, we've located the subject, the scene is not safe, and here's why. So your medic is going to call the individual's name. Hopefully it's the same subject that we're looking for. And they're going to approach from the feet because we don't want to scare them. So we're going to come up. We're not going to gang up on them. Only the medic and the assistant medic are going to come up. If you're wearing sunglasses, remove those so the subject can see your eyes. You want to check the airway and breathing and circulation. You can do that pretty quickly, really. So first of all, if you call their name and they respond to you, they don't really have an airway problem. If they're unconscious, you can tilt the head just like you would for CPR. And you can listen for breathing. You can watch the rise and fall of the chest. And you will want to take a pulse as a baseline. So you're going to take the pulse on the if they have an injured arm, you're going to take it on the non-injured side. or you're going to do it at the neck, at the carotid artery. Breathing, what you can do is you can actually assess for a full minute, 30 seconds for the pulse and 30 seconds for the breathing. You just want to count the rise and fall of the chest as they breathe. You don't want to tell them that that's what you're doing, because they'll alter how they're breathing, and they'll, in some cases, try to slow their pulse down, or maybe it'll speed up because they're nervous. So just talk to them normally while you touch their wrist, and keep your eyes on the chest. It might be helpful if the assistant medic actually measures the time for you. You want to look for anything unusual in the disability, so you're going to start with the head, and you're going to feel the head for any bumps or contusions. You're going to feel for blood. You're going to work all the way down to the toes. You want to make sure that you unzip any jackets and get in as close to the skin as possible. This is not the time to be squeamish or uncomfortable if you're dealing with somebody of the opposite sex. If they're hurt, you've got their permission when you called their name. So you need to go through and check every part of them, particularly if they're wearing a rain jacket. Rain jackets won't let moisture out any more than they'll let moisture in. Then you want to go through your sample. You want to talk to them about their signs and symptoms. What do they think is going on? And you want to ask them if they've got any allergies, like medicines, bee stings, anything like that. What medications they might be on, or that they didn't take when they should have. Any other pertinent information in the last time that they ate or went to the bathroom, and what were the events that led up to the reason why you're out there searching for them. So you're going to want all of that information. That's going to be important when you hand the subject off to the EMS, or you get them back to base. Even if they walk out, you're going to do a debrief with the OL and the incident commander, who will be the sheriff's deputy, and they're going to want to know some of those things. Now, some of that's going to depend. Some of that's going to vary. If when you're doing the short report, you're telling us that they're just cold, and that or they're dehydrated, then it's a pretty simple fix, and as long as they're not complaining of any injuries, you may not have to do a whole lot with the right side of the card. So I hope that helps. The Glasgow Coma Scale, that's some interesting information. May or may not be relevant in our situation. Basically, for level of consciousness, we want to use this 4-point system, which is: 1 is if they're unresponsive, so they're out cold. 2, if you pinch them and they moan, so they're not unconscious, but they're not totally able to respond to you. If they moan or move around a little bit when you talk to them, that is level 3. And if they're having a conversation with you, that's alert and responsive, and that's level 4. Another way of looking at it is, can they answer these 4 questions? Who are you? When are you? Where are you? And what happened? So that's the end of this presentation. I hope that helps clarify a little bit about the medical assessment card. It's supposed to act as a prompt, not a replacement for your own common sense. So use it to help make sure that you're getting all the information that you need. But it's probably not a good idea to just pull out the card and read through it. Make sure you're familiar with it beforehand. The assistant medic can have it stashed away in their notebook so that they can prompt you if you seem to be missing anything. But the ultimate goal is we want to instill confidence in the subject.